to address chronic pain symptoms. And I'll begin the presentation in just a minute. Okay. All right. So today we are going to talk about how we retrain the brain to address chronic pain. I'm going to give a brief overview of the topic. I'm going to talk for about 20 minutes, and then we'll break for Q&A. And then this event is over at 12:45. All right, let me see. I see there's something in the chat. Okay, that's perfectly fine, Kathy. If you disappear and you have to rejoin on a different device, feel free to do so, and I'll admit you into the, from the waiting room again. All right, so our topic today, for those of you just joining us, is about neural retraining for chronic pain symptoms. My name is Madeline Lowry. I am trained as a nutritional therapy practitioner originally, and also as a certified MAP method practitioner, which is a form of advanced neural retraining. As I said, I'll be talking for about 20 minutes. I have a little presentation prepared. This is really just a brief overview of the topic, but I will point you to a lot of resources at the end where you can learn more. Okay. So today we're going to cover, what is neuroplastic pain? Plastic meaning changeable, and neuro having to do with the brain, right? So what kinds of pain respond to working with the mind, with the brain? We will talk about the role of the subconscious mind. And we will talk about what I call the Sarno principles. These are the principles of John Sarno, who wrote several books on chronic pain and how mind-body methods work to address chronic pain. I will also talk about how advanced neural retraining methods can be helpful, how we use them, and about the MAP method, which is the particular method or approach that I use. And then, like I said, I will point you to resources so that you can learn more on your own if this topic is interesting to you. So let's talk about neuroplastic pain, right? And in this, please keep in mind this entire presentation, we are talking about chronic pain, not acute pain, right? Acute pain is like when you get that paper cut or when you break that bone, right? There's going to be pain. When you burn yourself on the stove, right? There's going to be pain. That is acute pain. It is directly related to tissue damage, right? It is the indicator, that something has happened and that we need to get medical attention. What I'm talking about in this presentation is chronic pain. Chronic pain is pain, maybe there was an injury at one time, but that injury, the time frame for that injury healing has long passed and still the pain remains. Maybe there was no injury, just a pain symptom that keeps showing up for you. And you've had it checked out and there's no organic reason to be having this pain, but there it is, right? So when we talk about neuroplastic pain, we are talking about non-structural pain that is generated or amplified by the brain. This is a type of conditioned response or conditioned behavior maintained by the brain. The person who tends towards this kind of response, person who forms this kind of response, has a brain that is highly sensitized to nerve signals, right? This is a person who has a brain that is kind of stuck in the on position, right? That impulse, whatever it is being interpreted by the brain in a way that's like almost ringing, right? Over time. It's replaying again and again. It is sustained. It is chronic. The triggers for these kinds of conditioned responses or conditioned behaviors may include time of day, may include certain places, certain activities, certain body positions, certain stressors, pressures, tensions. You may find that your pain is inconsistent, right? Some days better, some days worse, better in some certain situations and not in others. This pain may move around, or you may find that you have multiple symptoms over time. Because the person who is more likely to develop these kinds of conditioned responses, they have a predisposition to do so. And so this may result in chronic pain symptoms in different parts of the body over time. You might have migraines when you're a teenager, but then later it's pain in your shoulder, your neck, your hip, your foot, your, some other part of the body. The other thing we know about neuroplastic pain is it is amplified, it is exacerbated by our emotional state, and fear and anxiety, worry, concern, pressure, stress, right? These are the kinds of emotions that exacerbate our perception of pain. So what I want you to understand is that neuroplastic pain is caused by a brain that has become stuck in a pain pattern, and that most chronic pain is neuroplastic pain. How much? Well, in his book, The Way Out, written by Alan Gordon and Alon Ziv, 90 to 95% of chronic pain is neuroplastic pain. Let's talk about the role of the subconscious mind in this, right? So mostly when we talk about the brain, we are thinking about our conscious mind. We are thinking about this thinking, rational mind that we use, to study subjects, to get degrees, pass exams, help us with the crossword puzzle, help us figure out strategies for dealing with life, right? That's our conscious mind. That is the part of the mind that we are aware of, the part of the mind that we are directing most of the time. But that only accounts for about 5 to 10% of all brain activity. 90 to 95% of all brain activity is subconscious. It is the subconscious mind that runs all the functions of the body and always has. It is the subconscious mind that interprets that brain signal, like that nerve impulse that I was talking about, that comes from that part of the body. It's registered by the brain. And once the brain makes an interpretation of that signal, that is when we feel pain. It feels instantaneous to us. It feels like the pain is coming from that part of the body because this happens so fast, faster than the speed of light, But actually, there is no pain, That nerve impulse is being sent to the brain, and there is no pain until the point where the brain makes an interpretation. As I said, fear amplifies pain. Fear, tension, stress, pressure, anxiety, worry, concern, right? These emotions amplify our perception of pain. I want you to know that the same part of the brain that processes emotional pain also processes physical pain. And so there's kind of an interplay between these two. Sometimes for some people, that they don't feel their emotional pain, they feel it as physical pain. And for some people, emotional pain has an effect on the physical pain that they feel, right? So there's a relationship here. Also know that all conditioned behaviors are based on structures of memories. What do I mean by that? Everything you've ever experienced in your life is a memory, is encoded as a memory in the subconscious mind. I work with a lot of people that tell me I don't have a lot of memories from my childhood. There are plenty of people like that. Or I have a really poor memory, That is your conscious mind you're talking about. Your subconscious mind has access to all memories. And these conditioned behaviors that I'm talking about are based on compilations of memories experienced over time. So we like to say Your next behavior, your next response is based on all previous experiences prior to that. I also want you to know that the subconscious mind has a self-healing capability. It has the ability to heal itself. And this is what we utilize with advanced neural retraining techniques like the MAP method. We'll talk about that more in a little bit. So I want to talk about John Sarno and his work with chronic pain. So as I said, John Sarno was a Western trained physician. He was a back pain specialist. He worked at the Rusk Institute of Rehabilitative Medicine at NYU Medical Center for like 40 or 50 years. And when he started, he did all the things that he learned in Western medicine, right? He used meds and physical therapy. He looked at scans of people's spines. He referred them for surgery, if that was necessary. But what he found was he wasn't really getting, he felt like he wasn't really getting the best results for all of his patients. And so he started to explore some more radical concepts. He started to look into the role of the mind in chronic pain, particularly back pain, because that's what he specialized in. Part of what pushed him in this direction was his dissatisfaction with his ability to help all the people that came to him, right? And he would see some people do well and other people not so much, which led him to believe like he wasn't really getting to the true root causes here. The other thing is that he started to talk about, evaluating these scans, right? And realizing that, though he had been trained to look at these scans and see abnormalities on them and to interpret them as the root causes behind the pain, over time, with more and more experience, seeing more and more scans of people's backs and then the relative amounts of pain that they experience, he realized that there are people with absolutely atrocious looking scans who had relatively no back pain, and other people with not that much going on in their scan who had really long-standing or severe back pain. And so we started to talk about normal abnormalities, right? The kinds of things that you would see on a scan that, well, some practitioners would say, this is your problem. He would say, I'm not convinced. I'm not convinced that that's the root of your problem. He started to explore, as I said, he was pretty radical for his day. This is the 1970s, 80s, 90s. He started to explore the psyche, our thoughts and emotions, and the connection that they had with chronic pain syndromes, because he recognized that amongst his patients, there were certain personality types, right? Certain personality traits, certain common characteristics or histories. And he talked about the plight of the perfect and the good, right? The people who were highly successful, very motivated, very conscientious, for whom it was important to be perceived as being a good person, by society, by their family, in their groups, at work or whatever. And he talked about the kinds of emotions that necessarily have to be repressed in order to be that perfect and good person, right? In order to be self-sacrificing so much of the time, he felt that this meant, that there was a large store of kind of repressed anger and rage. So he was very much focused on anger and rage. This is either, I'm telling you about Sarno principles, but I just want you to know I don't subscribe to all of them, right? I don't think it's all about anger and rage, but he was getting somewhere, right? This was his own investigation, his own insights. And I think, he's responsible for getting us to a place of starting to look at, the thoughts and emotions, which was, a huge leap already. So he described this condition, which he called TMS, tension myositis syndrome, by which the subconscious mind could create pain, not only in the back, but in any part of the body. because the subconscious mind runs all systems of the body, right? And so what he described was tension held in the in the muscles, which would create a situation. It was kind of like a little bit of oxygen deprivation that would create a pain sensation in a certain part of your body. And he felt that this was the mechanism behind chronic pain. So what he felt the root causes were in the psyche, repressed emotions, certain personality traits, certain ways of dealing with life that, created these repressed emotions. The repressed emotions were in danger of acting out, and the brain created the pain as a distraction. No, we're not going to go there. We're not going to look at that repressed anger, right? We're going to create this pain instead to distract you. That was his conception of it. The way I look at this is a little bit different. I look at it as it is exactly those repressed emotions, traumas, thoughts, experiences that are creating the pain because, for exactly the purpose of like letting you know that there is something here you haven't dealt with and it's time to do so now. So the pain is like an indicator. It's a signal. It's calling your attention. It's not going to let you ignore this any longer. Now is the time to deal with this. John Sarno also talked about the symptom imperative because he felt that other practitioners who maybe were having success with, surgical methods or physical therapy or drug treatments or whatever, with certain kinds of pain. Let's say you had carpal tunnel and then you had the surgery for it and the carpal tunnel got better. But then wait a few years, now you have shoulder pain. Now you have migraines, or now you have hip pain or knee pain, right? He felt that even if you were able to alleviate the problem through physical methods, if you didn't deal with the underlying root causes, the brain would just create pain again somewhere else. Again, he felt that this pointed to root causes that went below just the physical. So, with the benefit of that perspective, let's talk about how neural retraining can be helpful, right? You are experiencing chronic pain. Remember, all pain, even acute pain, is an interpretation by the brain. That nerve signal goes up to the brainstem, and the brainstem makes an interpretation of that. How painful, or what is that sensation? Is it itch? Is it burn? Is it throb? Is it stab? Is it, or is it pain, right? Is it tingling? It makes an interpretation and it decides on the intensity. Remembered pain exacerbates current pain. So any pain that you've had, especially in that part of the body in the past, will exacerbate your current experience of pain in that same area. The meaning that you give to the pain, the significance that you give to the pain, can intensify the perception of pain by engendering fear, right? So if we feel like, or we think that pain means there's something really wrong with me, or that pain means my cancer is coming back, right? These are very scary thoughts. The emotions that they create in us can be a reinforcing factor in maintaining the pain. So there's kind of a cycle going on here. I call it the pain cycle. The stresses, the other thing I like to work with is looking back at what was happening in your life prior to the onset of symptoms. What pressures were you under? What tensions? What life changes did you experience at that time? What was happening in your life in the months to years leading up to the onset of symptoms? That is something that we explore and we can work with in sessions. We also work on releasing subconscious repressed emotions. John Sarno talked a lot about anger and rage. I find that really any negative emotion is, it's not just about anger and rage. Any negative emotion is a candidate for something we may have repressed or pushed away, either at some point in our life or continue to do so, that may be a contributor, right, to perpetuating chronic pain. We can use neural retraining to change our response to triggers for pain, right? So if a certain chair causes you to feel pain after you've sat in it for, say, 15 minutes or so, or certain body position, a certain activity, exertion, for example, certain kinds of exertion, right? We can explore the patterns that have created that conditioned behavior, that conditioned response, because anything that has been learned by the subconscious mind can be unlearned. In neural retraining sessions, we can also alleviate our resistance to pain. So our response to the feeling of pain, the experience of pain, well, for many of us, right, because pain is uncomfortable, is I don't want that pain. This can't be happening to me. This shouldn't be happening to me, right? There's a lot of resistance. And that resistance can be part of this pain cycle. It reinforces the continuity of pain. So by working with resistance, by making us more accepting of and more neutral, be able to have more equanimity around the pain, this allows us to make changes to that pain pattern. And often that's where we start, neutralizing, our responses to the experience of pain. So the method of neural retraining that I use is the MAP method, M-A-P. It is the latest energy psychology technique. You may have heard of other energy psychology techniques like EMDR or EFT or tapping technique, right? With each of those techniques, tapping, you were tapping on acupuncture points while we process a certain trauma or memory, while we process a certain negative thought or something. In order to enable the mind to kind of access and fully process something that has gotten stuck, right? That we haven't fully dealt with, so that we can release it. EMDR, bilateral stimulation, either using the eyes or something else. Again, trying to enable us to release something that has gotten stuck or trapped, which is affecting us and is preventing change. The method is the latest generation. It's very new, while EMDR and EFT are techniques from the 1980s. The method is only about 7 years old. Has only been taught for maybe about 5 years. There are less than 200 practitioners in the world. With this technique, we work directly with the subconscious mind in sessions. We do these sessions over Zoom video conference, and it is not hypnosis. It is a meditative technique. In other words, you will have your eyes closed, breathing slowly, deeply, and gently, focusing on your breath, or on a memory, something else that we ask you to focus on for most of each session. Why? Because this rewiring process, this self-healing process, the subconscious mind being able to heal itself, patterns that are unwanted, undesirable, is a self-healing process, and it is an eyes closed process. Your sessions are facilitated by a practitioner. Yes, the subconscious mind is healing itself, but there is some guidance, right, by the practitioner. The practitioner is listening to you. The practitioner is understanding your experience. It's picking out the patterns. It's identifying, the contributors, to this chronic pain pattern, and is aiding your subconscious mind by offering certain instructions, which your subconscious mind is able to enact or not enact as it sees fit. So your mind is rewiring itself in a session. During sessions, my clients will have changes in perspective. They will have new insights. They will become more aware of their patterns, their deeply held beliefs. And I'm not talking about religious beliefs. I'm talking about, like, I don't know, deeply held beliefs like I will never get better, no one can help me, I will always live in pain, things like that. I'm unworthy of healing, or whatever that may be for you, whatever particular flavor that is for you. But we start to uncover these things, right? These are all like blocks and barriers to your recovery. And so with neural retraining, advanced neural retraining techniques that work directly with the subconscious mind, we can neutralize old patterns, old ways of thinking, and replace them with new ones. You do this in the session. As you said, it's a self-healing practice. No one is forcing something on you. No one is doing something to you. It is, it's about your subconscious mind finding the healing path that is best for you. So I've talked a little longer than I was planning to. You can learn more about this at my website, tcneuralretraining.com. TC stands for Twin Cities. That's where I am. On that website, you can see the explanatory videos that describe the science behind the MAP method. You can watch QEEG brain studies of brain activity during a MAP session. You can watch a demonstration session of a MAP session being done for a phobia, something that we can usually handle in one session. And you will also find, this little quiz here just to see if subconscious stressors might be a factor in your pain syndromes. You can also visit my other website, mapforhealth.us, where there are free courses about the MAP method. You can take a free course on what is the MAP method, describes the history and the science behind the method. Another course is about mind-body healing and how we use the MAP method to address physical health conditions. And the third one is tips for more effective MAP sessions. So those are there for you. And then I also have a podcast, the Flourish with Neural Retraining podcast. And you can hear me talk about this and many other subjects. You can hear my clients talk about what they've experienced through a set of MAP sessions. So that's kind of fun. Okay, so I'm just going to quick show you the website. These videos that I'm talking about are right here on the home page, right? Here's video number 1, science behind the MAP method. Here's video number 2. This is brainwave studies done in a laboratory showing the brain's response to verbal instructions being given by a MAP practitioner. This is video number 3, the demonstration session. You can see how this client, Leona, responds to a session on her fear of flying. Also, you will notice there's a podcast tab. And one of the episodes you might be interested in is this one, MAP for Chronic Pain. This is about Helen. Helen comes on the show. She tells her story about having ankylosing spondylitis, a very painful condition. It's an autoimmune condition, and how she experienced pain relief in about 6 sessions with me. Before I stop sharing, I just wanted to show you that if you are interested in seeing the replay of this talk, you can find it on my YouTube channel. It's under my name, Madeline Lowry. And you can see the videos from previous talks. All right. I will stop sharing here, and I will also stop the recording so we can have